views and opinions expressed on this program are those of the guests appearing on the program and do not necessarily reflect the views and opinions of 8 News Now or Nexstar Media Group.
I'm not bluffing. I'm not playing a game.
Tonight on Politics Now, Governor Steve Sisolak tells Nevadans to stay home for 2 more weeks. The consequences if we don't follow the rules.
We've been getting our butt kicked.
A blunt assessment from Sheriff Joe Lombardo, how Metro Police is dealing with COVID-19 within the department. And the results will soon be final. Clark County wraps up its ballot count from the election, while the Trump administration disputes the results.
From 8 News Now, this is Politics Now.
Thank you for joining us on Politics Now. I'm John Langler. Stay home again. Governor Steve Sisolak issues a 2-week request for everyone to quarantine as the coronavirus spreads. Governor Steve Sisolak says Monday marked the highest hospitalization rate in the state since mid-August. And if things don't change in the next 2 weeks, he'll be forced to take stronger actions.
In the next 2 weeks, we must see a significant reversal of the current trends, which are deeply concerning now. Nevadans need to operate in a stay-at-home 2.0 mentality to get things under control so our public health response infrastructure can catch up. We need that time to bring testing timelines down, catch up on contact tracing, and relieve our healthcare infrastructure system.
Governor Sisolak encouraged people to work from home, continue social distancing, and wear a mask in public. In Reno, hospitals there are at or near patient capacity. Southern Nevada hospitals, though, put out a joint statement saying they're at lower capacity than they were the same time last year. But they're encouraging you to take care of your normal medical needs and your elective surgeries. So, how can the state ask us to stay home while businesses that keep the state moving stay open? I spoke with Clark County Commission Chairwoman Marilyn Kirkpatrick.
How are you going to be able to walk that balance and walk that fine line?
So we've been walking that balance for a very long time, and we have to look at public health first. But public health also is economic and social health and mental health. So we are, look, we have a bunch of great folks here in Clark County. They've really been stepping up and doing the extra efforts. I get that people are COVID fatigue. I think we could all agree to that. But we're going into flu season now, and we really have to make sure that our behaviors are top notch. I mean, this is the time. We always knew that as the weather got colder that we would see more cases because that's just naturally what happens to us during flu season. So what I would tell you is the best thing that we can all do to keep businesses open, to keep our community healthy, is to just pay extra special attention to washing your hands, wearing a face mask, and social distancing. And that, and I'm confident that we value staying open, that we can do that in the next few weeks.
Is it possible for Clark County to step in and close businesses on its own again?
So we have. We've been shutting down businesses that have not been complying, not trying to comply for the last, 7 months. So we did have a small miscommunication of whose jurisdiction was what, but I'll tell you that all of the business licensing across the valley, including OSHA, Gaming Control Board, the Athletic Commission, are all meeting once a week, and we're looking at where our problems are.
I guess I meant more broadly, if there was going to be, I remember the governor had the phases early on in the pandemic. Is it possible that Clark County could, on its own, if cases continue to increase and there's more of a public health concern, step in and shut down, let's say, bars or restaurants, or close down gyms and athletic facilities, things along those lines?
We can always be more restrictive than the governor's directive. We can also go to the mitigation task force and recommend some of those closures. But I can tell you this has been very hard for everybody. You know, we have to balance people being able to pay their bills as well as businesses who are trying to stay afloat during these tough times. And so I'm just hoping that with the public health that people will really pay attention. So, some of the things that we're seeing are unregulated businesses that are creating the problem. So whether it's a group of people getting on a bus and renting a house and partying all night with no face mask, or whether it's your law firm that's hosting a luncheon with no social distancing, no face mask, no washing your hands. Those are the things that I need people to pay attention to for the next 3 to 4 months, because it is our flu season and we always have to make sure that our hospitals do not get overrun.
If a community the size of Clark County has unused funds, if there's a need to ask for more federal assistance, for example, if the money that's already been dished out hasn't all been used, would there be a need for more?
Here's what I would tell you. It's apples and oranges, because the dollars that we got today were specifically to filling the needs of a community during these times. But for local government in particular and state government, there's a lost revenue component because this money has to be expended by December 30th. So we know that January 1st, there's going to be tons of evictions that are on the chopping block. We know that coronavirus, we're still going to be in the middle of it until we can get the vaccine here. So we're still going to have needs. And with that lost revenue on the local and state level, we still have to provide service. So when times are bad, we provide lots of service. When times are good, we still have to provide service.
The legislative session won't be easy either, funding-wise, down the pipe.
No, and we get a large portion of our social service dollars from the state. So we are watching that very closely because we still have to provide all those services.
As for, again, that question about the extra funding that Clark County is going to discuss this coming week at Tuesday's meeting, that is federal money, $294 million or so, and some of it just wasn't used yet. If you want more details on that and the full interview with Commissioner Kirkpatrick, just head to 8newsnow.com. This week, President-elect Joe Biden began releasing details on how his administration will tackle the COVID-19 pandemic. He says stopping the spread of the virus is the most important thing, and that will help revitalize our economy. Washington Bureau correspondent Alexandra Limon has a reaction to his plan from business groups.
President-elect Joe Biden says his national strategy for things like a rapid COVID testing program will save lives and the economy.
So that we can reopen our businesses safely and sustainably, resume our lives, put this pandemic behind us.
40% of excess unemployment is in the travel industry.
Tori Emerson Barnes says the U.S. Travel Association has been calling for a federal testing strategy for months.
It can really help to give folks confidence to travel again in a more robust way. And so we absolutely would support these kinds of practices being implemented across the country.
The U.S. Chamber of Commerce also wants to see the federal government issue a standard set of COVID-19 guidelines to be used around the country,
so that on a local level, officials know what steps to take that can best minimize the spread of COVID and also minimize economic shutdowns.
Neil Bradley with the Chamber of Commerce says the national strategy needs to be science and data driven.
We believe the key to getting the economy back to where we want it to be, which is where we were before we ever heard of COVID, is beating this virus and getting control of the spread.
In Washington, Alexandra Limon.
President-elect Joe Biden has outlined plans for his incoming administration on the coronavirus response. What are some differences right now between what the current administration is doing and what the future administration is going to do?
Yeah, what we've seen the Trump administration do is kind of allow the coronavirus pandemic rules, regulations to be handled on a state-by-state basis, allowing governors to issue their own rules. And while that's sort of how it has to happen because of just the kind of political system that we have set up in the United States, Joe Biden wants to try to implement a more national strategic plan. So, for example, instead of waiting for states to request tests, he says he wants to provide all of the states a lot more access to rapid testing so that people can get tested right away in a quick manner when they feel they need it or they have concerns or questions about whether they could have been possibly infected with COVID-19. He also, for example, wants Americans across the country to wear masks. Joe Biden does. And we've heard him talk about that in the past, but while he says he can't issue a nationwide mandate, he says he does want to work with all governors around the country to get them to issue state mandates if they don't already have them in place, where on the other hand, we've kind of seen President Trump take a more laid back approach and say, whatever these governors want to do, that's fine. So some very definite differences there.
Thank you very much. For the latest from Washington, D.C., Alexander Limon. Thanks for joining us. So among those on the front line dealing with coronavirus are police officers. On our Morning Cup of Joe segment, I spoke with Sheriff Joe Lombardo from Metro Police about how the department is handling the epidemic. We've talked also before about COVID-19 and the effect on the department. We know about it's already hit close to home, not only for you personally, but for the department in general, what the coronavirus has done. What is the latest on cases, officer wellness in the department?
It's not going the right direction. So in the last 3 weeks, for lack of a better way to describe it, we've been getting our butt kicked. We're averaging between 5 and 10 positive employees on a daily basis. If you look at our total numbers since the beginning of March, we're right around 460 positive employees. So with my total workforce, if you did the math on that, it's around 7% positive compared to the workforce. So the benchmark for the state and the county is 8%. So we're below that benchmark, and which is important to evaluate because we have a little more interaction with the general public than most people do. And so it's not like we can work from home in that vein. So I think we're doing a pretty good job addressing it on a daily basis, but we have concerns in the back of my mind personally that those numbers are going to continue to increase, because the particular problem with it is not only the positive employees, it's the contact tracing and the other employees that have to be quarantined that were in close proximity of the positive employee, and that number is hovering right around 300 in today's number. So if you think about a cop responding to a call for service, we have to back all that up with overtime and the budget concerns, and that's my job. That's something I have to worry about, and that's what I get paid to do. But it's important for the public to realize what's going on.
So if as you say, COVID is, as you said, kicking the department's butt right now,
Right.
What can be done? It's not like you can arrest someone while being socially distant. What measures are being taken at Metro?
We just got to ensure, the mandate that I put forward on PP&E, that the officers continue to do that. And sometimes it's a simple thing is when they're at home, a family member becomes positive and they become positive, so they have to be aware of that. And even at work, even having lunch with fellow employees, they have to be aware of their social distancing and washing their hands and all those things. They constantly have to be reminded of those triage methods that they have to be aware of. And we continue in that vein because until a vaccine appears miraculously, we're going to have to deal with it on a daily basis.
Coming up next on Politics Now, it's almost official. The final steps to putting the November election in the books.
Welcome back to Politics Now.
The final election results are all counted. So here's an update on a few close races here in southern Nevada. Democrat Ross Miller hung on to beat Republican Stavros Anthony in the race for Clark County Commission District C. The difference, just about 570 votes. That is to fill an open seat on the commission. There are a few seats with big implications at the legislature. First, State Senate Majority Leader Nicole Cannizzaro hung on to her seat in District 6, beating Republican April Becker by about 800 votes. Cannizzaro was down after some of the initial results. Also in the state Senate, Democrat Christy Watson beat Republican Carrie Buck in District 5 by 200 votes. That is also an open seat that was previously held by a Democrat. In State Assembly District 37, Andy Matthews beat incumbent Democrat Shea Backus. The difference there, fewer than 600 votes. So the votes are all counted here in Clark County. Next up is the canvassing. Provisional ballots and any signature curing wrapped up by midnight on Thursday in Clark County. The provisional ballots include people who registered to vote on Election Day. However, Nevada Secretary of State's office is still verifying some of those registrations, and there are still legal challenges to the election from President Trump's campaign. Here in Clark County, we have Registrar of Voters Joe Gloria.
I have no information on exactly what they've identified as those ballots, but we'll certainly look into it if they give it to us. Unfortunately, they don't give those reports to us. They're just going out to the media. Unfortunately, there's a lot of misinformation that's being put out there, but I have consistently communicated to the general public and the media that any instance or irregularity that has been pointed out to us we've come up with an answer to explain exactly why those occurred. We will continue to do so.
All those vote totals are expected to be certified by Clark County Monday afternoon. Candidates then get 3 days to request a recount. The county has to finish a recount then within 5 days. Asian American and Pacific Islanders are the fastest growing ethnic group nationwide. And in Nevada, they are also growing the fastest. So how did they vote in the last presidential election? Well, APIA Vote says there were about 209,000 eligible AAPI, Asian Pacific Islander voters, here in Nevada. That's about 11% of our eligible voters. The group says their exit polling shows they voted for former Vice President Joe Biden 58% to 40% for President Trump. Full-time distance learning across most of the Clark County School District. Trustees postponed a vote on CCSD's plans to bring students back to class. Sasha Loftus explains why.
I think that they did the right thing by tabling the discussion.
Parents Jeffrey and Emily Balcom share their thoughts on the latest Clark County School District discussion.
So I want families and students to know that I recognize their struggles, but I also recognize this decision is too important to rush.
In Thursday's virtual meeting, CCSD leaders postponed a vote to transition to hybrid learning, citing a recent spike in COVID-19 numbers.
We need to have a plan where people are volunteering to go in without worrying about losing their lives.
The 205-page plan would have gone into effect in January, but with the governor's latest suggestion to stay home, that vote was tabled until further notice.
There is more work to be done, and if this board's inability to make a decision has now hampered that, we are hurting our children even more.
While it's clear some are against the plan to postpone, the Balcoms say now is not the time to make a definite decision.
We couldn't make a decision as parents because we don't know what, as Dr. Jara said tonight, he doesn't have a crystal ball.
They say they're willing to hold off until they know their kids are safe.
I think the best decision for parents and families and teachers is going to end up being the most informed decision, and we have to wait.
Sasha Loftus, 8 News Now.
The trustees did not choose a future date to vote on this plan again, so it's actually unclear if or when it'll come up for discussion one more time. Coming up next on Politics Now.
Veterans advocates are pressing members of Congress to pass legislation that could help veterans exposed to toxic burn pits. I'm Kelly Meyer reporting from Washington. Why they're asking lawmakers to get these veterans the benefit.
You're watching Politics Now.
Wednesday was Veterans Day here in the U.S. There was a ceremony in Boulder City over at the Southern Nevada Veterans Memorial Cemetery. You're seeing there 1,440 flags placed on the grave sites of all fallen veterans. Thousands of veterans are waiting for help after being exposed to toxic burn pits. The Department of Veterans Affairs has denied about 78% of disability claims related to this exposure. As Kelly Meyer tells us, veterans and lawmakers are not taking no for an answer.
Due to the pandemic, comedian Jon Stewart's latest push to support veterans is happening virtually.
Hey everybody, it's Jon Stewart.
Hi everybody, John Field.
After working with John Field to secure funding for 9/11 first responders,
there really is an urgency to it.
This is not normal.
They're now helping victims of toxic burn pits facing barriers to VA benefits.
You know, the VA should be acting on behalf of the veterans, not as an obstacle.
The VA says all veterans of Operations Iraqi and Enduring Freedom are eligible for 5 years of free VA health care regardless of service connection. In the last 13 years, 78% of disability claims related to toxic exposure have been rejected by the VA.
They've been denied routinely.
New York Democratic Senator Kirsten Gillibrand introduced legislation to make it easier for victims to get benefits. North Carolina Republican Senator Thom Tillis has his own separate legislation to create an independent commission to investigate allegations of toxic exposure from troops and veterans.
What we need is not a study or discretion. What we need is a presumptive benefit.
Gillibrand says she's working to get her legislation passed before the end end of the year. If it doesn't, Field and Stewart say they'll be back.
It's going to take everybody. Everybody.
We always have our eye on, what the goal is.
Reporting in Washington, I'm Kelly Meyer.
Burn pits have long been an issue. In fact, it's how the existence of Area 51 was first revealed to the rest of the world. Workers at Area 51 said they were exposed to toxic fumes from burn pits at the secret military base, then called the Nevada test site. Employees were trying to get compensation from the federal government after contracting diseases like COPD. It was that fight which sparked the first reporting on Area 51 by our own I-Team's George Knapp decades ago. In this week's What to Watch, we are keeping a close eye on the coronavirus cases here in Nevada. Governor Steve Sisolak threatened that he would take stronger actions if the number of cases did not start to go back down. The number of hospitalizations key to that as well. Also, the canvassing of the election takes place this upcoming week. County boards will meet and discuss any problems with provisional ballots, signatures that don't match, or other issues. In Clark County, this discussion will be on Monday in the commission chambers, and then they'll put the state's final seal of approval on the November general election results. Thank you very much for watching Politics Now here on 8 News Now. For all the latest election news, just head to 8newsnow.com and you can check us out there. We're back on Saturday.